In this video, we'll cover the revised IHS criteria for migraine. So basically, we will consider this classification in two categories. One is without aura and one is with the presence of aura. All right. So first of all, migraine without aura we will do. So we will do migraine without aura. Now over here what happens in this classification is you divide A, B, C, D accordingly to the symptoms that are given. So in first A, what we see is headache descriptions. At least two should be there. First, if it is unilateral, if it is pulsatile quality, then if it is moderate to severe pain intensity. Now in moderate what you will see is that it will basically inhibit the daily activities, but in severe it will prohibit. Okay, then there is aggravation or aggravation by or causing avoidance of routine physical activity. Then the last point is associated symptoms. In this we can mention about nausea, vomiting, photophobia and phonophobia. Okay, now this is the A category. Now coming on to the B category. In B category what we see is we see that the headache lasts for 4 to 72 hours. 4 to 72 hours. Either it is because it is untreated or it is treated unsuccessfully. Treated unsuccessfully. Now in C, what we see, C category, we see that the patient, he must have 5 attacks fulfilling the above criteria, and it should not be attributed to any other disease, and not attributed to another disease. Okay, now we will discuss about, first we were discussing about without aura, now we will discuss about with aura. So second, migraine with aura. Okay, over here also we will divide them into A, B, C, D as well. So basically we need at least, it should fulfill at least two criterias. Okay, so in A what we see is that the aura should consist of at least, aura consists of at least one of the following, but no motor weakness. Now what is it? The first one is fully reversible visual symptoms. Now these symptoms, either they can be positive or they can be negative. Now positive as in flickering of lights or spots or lines. In negative what we see is full loss of vision, so loss of vision. Then the second one can be fully reversible sensory symptoms. In sensory symptoms again, we can have some positive symptoms, we can have some negative symptoms. In the positive symptoms of sensory, what we see is we see pain on pins and needle like sensations as if they're pricking. Also in negative what you will see is complete numbness. Okay, so this is the A criteria. Also one more, the third one is fully dysphasic speech. Fully dysphasic speech disturbance. Okay, so I'll just highlight it visual, sensory, and dysphasic speech. Okay. Now in the B category, what we see is at least two of the following. First is the homonymous visual or unilateral sensory symptoms. Also, at least one aura symptom develops gradually over more than 5 minutes. Okay. Now, each symptom, it should be more than 5 minutes and less than equal to 60 minutes. Now in the C category, what we see is headache fulfilling criteria A and B for migraine without aura but begins during aura and follows for 60 minutes. Okay. Then D category is when it is not attributed to any other disorder, not attributed to other disorder. Okay. So I'll just sum up again once again. So basically we are referring to the migraine criteria, the classification. Either we divide them in without aura or with aura. In without aura, you have three categories A, B, C. First of all, we will see the symptoms. Okay, if it is unilateral, it is pulsatile, it is having the moderate to severe pain intensity, or it is aggravating by causing the physical activities, daily routine physical activities. Also, either if it is associated with some symptoms like nausea, vomiting, photophobia, phonophobia. All right. Then in the B category, what you see is it should last for 4 to 72 hours. Okay. Then coming on to then 5 attacks should be there. The patient must have 5 attacks fulfilling the above criteria and it is not attributed to any other disease. Then coming on to the next classification, which is with aura. Now with aura, basically two criteria has to be fulfilled. So in the first, what we see is we see symptoms that are reversible. So visual symptoms, sensory symptoms, and dysphasic speech symptoms. Just remember the positive and the negative symptoms and signs. Then at least two of the following, either both that we mentioned in the part A, right? And I'm sorry, just wait. Yeah. And we can also say that the aura should have at least one symptom which is more than 5 minutes. Also, each symptom should be less than 60 minutes, that is 1 hour. Now in C, if it is both, it is developing without aura but it begins after the aura, like during the aura, and it follows for 60 minutes. All right. And D, if it is not attributed to other disease. So this completes up the classification of migraine based on the revised IHS criteria. I hope you understood it. Thanks for watching.